Welcome to ThyCa session 145, Navigating Health Insurance. I am Brittany McKelvey, coming to you virtually, a pediatric thyroid cancer survivor and facilitator of the Teens ThyCa support group. Happy to introduce our session speaker, Nicole Jolicoeur, Esquire, and she is a cancer rights attorney at Triage Cancer Center in Chicago, Illinois. She earned a Juris Doctor from New York Law School. Nicole has a passion for assisting those diagnosed with cancer. She appreciates and shares Triage Cancer's mission to provide education on the practical and legal issues that those diagnosed with cancer may experience. Prior to joining Triage Cancer, Nicole was an Excelsior Fellow at the New York State Office of Mental Health and Counsel's Office. We're really excited for your presentation today and looking forward to it. Thank you, Nicole.
Thank you, Brittany. All right. The whole time. Okay. So I'm a staff attorney here at Triage Cancer, and today we're going to talk about making the most of your health insurance. But before I jump into the specifics on how to do that, I think it's always helpful for those of you who haven't heard of Triage Cancer to know a little bit more about what we do. So we're a national nonprofit organization, and we focus on providing free education on the legal and practical issues that individuals diagnosed with cancer may experience, as well as their caregivers. And we do that in a variety of ways. And the reason that I take some time to go through this is today's going to be a really brief overview of several different issues. And so I want you to know where to go for more information or what I'm talking about when I point you towards our resources. So we understand that people learn in a variety of different ways. So we have written materials that help people understand different topics such as taking time off, health insurance appeals, as well as brief animated videos. We do live webinars monthly that we record and archive on our website. And we also have our free conferences. So when we talk about the financial impact of cancer, one of the main culprits in causing financial harm for individuals is actually health insurance. And that's not just accessing health insurance, but understanding how to use your health insurance plan and pick a plan that works for you. And really, the problem is that health insurance is so complicated that most Americans don't understand how it works or how to choose a plan. So in fact, there's data that shows only 4% of people surveyed could accurately define the four most common terms used in a health insurance plan. And part of the reason this is so challenging is that we essentially have to learn a new language to navigate health insurance effectively. And we know from multiple studies that Americans just don't understand health insurance. And I want to put you at ease in case when we start going through, you're like, I don't know this. A lot of people don't. And I, in fact, did not before getting this job. So with that in mind, I'm going to start by giving us all the language that is used around these common terms. And I know some of you may be very comfortable with these terms, but I think it's important to start with so that we all have a context for what these rules and terms actually mean, and then how to figure out what our costs are going to be. So first, there's just the cost to have your health insurance. That's a premium. It's a fixed dollar amount, and you're going to pay that every month, no matter if you use your health insurance or not. Then there are four common terms when you're using your health insurance. The first is your deductible. This is going to depend on your plan. It's also a fixed dollar amount. It's the amount you have to meet according to your plan before your health insurance even kicks in and starts covering your care. This can be anywhere from $0 for some plans up to $5,000, $6,000, sometimes even more. And then there's a copayment. This is a fixed dollar amount as well. It's what you pay when you go to the doctor's office each time you get care. So for primary care, it may be $10. For an emergency room visit, it may be $100, and a specialist, it may be $50. Again, this is going to depend on your health insurance. What copayment often gets confused with is coinsurance or cost share. This is also going to depend on your plan, and it's the amount that your health insurance is responsible for and the amount that you're responsible for. So it's usually a percentage. So it may be that your health insurance covers 90% and you're responsible for 10%, all the way down to 60% and you're responsible for 40%. The most important term on here is an out-of-pocket maximum. And this is the fixed dollar amount according to your plan that once you hit this, your health insurance is going to kick in at 100%, no matter what your original co-insurance was, and cover your costs for the rest of the year, as long as you're going to in-network providers. So while these terms are easy to read, I found that when we actually try putting them to use, they're a little bit harder to navigate. And so we're going to start by meeting Dan. So Dan has a plan with a $2,000 deductible, a co-insurance of 80/20, and an out-of-pocket maximum of, sorry, something just popped up, $8,000. And so he just spent a week in the hospital. He has a $102,000 hospital bill, and he's had no other medical expenses this year. And he's really not sure what he's responsible for that $102,000. So the first thing he has to do is pay $2,000 because that's what his deductible is. This leaves $100,000 of his bill. So now his co-insurance is going to kick in at 80%. So he's going to be responsible for 20% or $20,000. And then this is why an out-of-pocket maximum is so critical. He's already paid $2,000 towards his deductible. So really, of that $20,000, he's only responsible for $6,000. I am not saying that $8,000 is not a lot of money. It is just less than the original bill and even less than if he had not that out-of-pocket maximum. And so if you think that you would like to hear this again, or you have friends or family members that this could be helpful for, it's in our animated video on health insurance basics, which you can find on our website. So Dan was a really simplified version of how this actually works to get used to the terms. And that's because we based it on a marketplace plan. And when we talk about marketplace plans, they include what you pay towards your deductible, your co-payments, and your co-insurance, all three of those things towards your out-of-pocket maximum. If you have different insurance, that may not be the case. So for example, if you have an employer-sponsored plan, they may not count what you pay towards your deductible. It may just be your co-payments or co-insurance. Some plans, it may just be your co-insurance, and others even exclude any costs that you pay towards prescription drugs, and you have a totally different out-of-pocket maximum. So I say this not to alarm people. It's just we want people to know where the differences are so that you can understand the terms of your plan and make the most out of it. So there are a few terms that are very specific to prescription drugs. The first of which is that there's a formulary for every prescription drug coverage. And basically, this is a list of drugs that are covered by your health insurance company. If your drug is not on the formulary, typically your health insurance is not going to cover that drug. And formularies are often broken down into different tier levels. So starting with the lowest tier is usually the lowest cost to you. Those are usually generics. As you work your way up, your health insurance is going to cover less. You're going to be responsible for more. Oftentimes when people are diagnosed with cancer, they find themselves in the highest tier, that tier 4 level, because they're specialty or newly approved drugs. And so just for an example of how this works, at tier 1, if you have a generic, then you're going to be paying about $5 flat fee. But as you move your way up, it gets higher all the way to the tier 4, where you're not paying a copayment, you're paying a co-insurance of 20%. And this is where we see people getting tripped up when they don't know the basic terms. So there are strategies that health insurance companies use to manage costs. And we're going to talk about a few specific to medical care at the end. But I want to raise prescription drugs here. The first is a process called step therapy. And this is typically where an insurance company requires that you start at a lower tier. That drug has to fail or you have to have negative side effects in order to then step up to the next level tier. So we get a lot of calls from people concerned that they're being pushed onto a generic when they have been on the brand name and that has been working for them. And this is an example of step therapy. Now, there are ways that people can request exceptions. So you can do a tier exception. You may be able to do a brand exception. And then if your insurance is denying it, you can appeal the coverage. And we're going to talk about that more in depth in a while. So when we understand what our terms are for health insurance, we need to understand also where we can go in the United States to get health insurance coverage. And in the United States, there's really only 3 places where you can go to get health insurance coverage. So about 50% of Americans get health insurance coverage through their employer or their family member's employer. Then you can get health insurance coverage through the government. Medicare and Medicaid are good examples. And you can purchase it privately through a health insurance company. This is through the Affordable Care Act. It's often referred to as Obamacare by people, and it is not government sponsored. It is directly from a private health insurance company, and we're going to talk about that more in a bit. So if 50%, of people get health insurance coverage through their employer, what happens if they lose their employer-sponsored health insurance? And the answer is, it depends. So one potential option is COBRA. It's a federal law that allows people to keep the same exact health insurance that they have through their employer. Now, the COBRA law has to apply to your employer, so it has to be a private employer with 20 or more employees or working for a local or state government of any size. If you work for a federal employer, you may have similar protections under a different law. Now, we hear a lot of concerns about COBRA because it can be expensive. Because in order to elect COBRA, you're now responsible for 100% of your monthly premium. So usually your employer's been paying a portion of your monthly premium. Plus, there can be a 2% administrative fee. So when we talk to the people about this, they immediately kind of shut down when they're concerned about the costs. But we think there's some important things to understand about COBRA coverage and weighing the benefits versus the cons so that you can pick a plan that works for you. So the pros of your COBRA coverage is you know how it works. You know your health insurance covers your providers that you prefer to go to. You know it's covering your medications. You know how to navigate it. The other potential pro is depending upon where you are in the year, you may have already hit your deductible and your out-of-pocket maximum. So while that monthly cost can be very expensive to keep the COBRA, if you're going to all in-network providers, it really might be your only cost for the remainder of the year because you've hit that out-of-pocket maximum. So it may end up cheaper, not always, but may, because if you go to pick another plan, first off, if you're looking in the marketplace, you may not be able to find a plan that covers all of your providers or your prescription drugs, but you're going to start over with a new deductible and a new out-of-pocket maximum. So even though that monthly premium might be lower on the marketplace, if you do the math, it may end up more expensive by the end of the year because you have to meet your deductible and out-of-pocket maximum over. So there are a few examples of government-sponsored health insurance as well that people may be eligible for depending upon their circumstances. Our first example is Medicare. I'm going to do a really brief overview here. We're going to go pretty quickly through several slides. Just know if Medicare is an option for you, we recently did an 1.5-hour webinar. It is on our website and you can listen to it. So Medicare is only available in 3 instances. The first is if you're 65 years old. The second is if you've been receiving Social Security disability insurance payments for 2 years, or if you have end-stage renal disease or ALS. That's it. We get a lot of questions about, well, I'm finally approved for SSDI. Don't I get it now? And no, you have to have qualified for payments for 24 months. Medicare is broken into parts. So again, we're going to go through this fairly quickly. The first part is Part A. It's considered hospital insurance. Most people who have worked and paid into the system get this for free. It covers your hospital stays, hospice, things like that. Part B is what most of us think of when we think of health insurance. So it's your medical insurance. It's when you receive outpatient care, see a doctor. And for most people, your premium in 2024 that they released yesterday will be $174 a month with a deductible of $240. Parts A and Parts B are referred to together as original Medicare because this was all that existed when they created Medicare. And it's actually fee for service. So what that practically means is there isn't a network of providers that you go to. Instead, you can go and get services across the country. As long as your healthcare provider accepts Medicare, Medicare is going to pay. For Part B, though, it's an 80-20 coinsurance. And if you notice something missing on our slide, there's no out-of-pocket maximum. So into infinity every year, people are paying 20% of their costs unless they purchase an additional plan called a Medigap or a supplement. You may have noticed I've completely left out prescription drug coverage, and that's because it wasn't in original Medicare. You can now purchase prescription drug coverage called Medicare Part D through private insurance companies. The cost is going to vary depending upon where you are and your income level. The deductible went up slightly in 2024, and your co-payments and insurance are going to vary based on the terms of your formulary. So for those of you who have friends or loved ones or yourself are on Medicare and you're frustrated with prescription drug coverage because of the catastrophic phase where, again, there's no out-of-pocket maximum. Instead, people are stuck paying 5% every time they hit that number each time they fill a prescription, and 5% of expensive medications is still expensive. That is getting eliminated in 2024 thanks to the Inflation Reduction Act. So the total out-of-pocket costs are going to be capped at whatever the catastrophic phase number is for next year. This year it was around $7,400, and you'll pay a flat fee. If it's similar to this year, it'll be somewhere around $10. So it's really lowering people's out-of-pocket costs. In 2025, there's actually going to be an out-of-pocket maximum of $2,000. And understanding that $2,000 is still a lot for people, there's going to be provisions to smooth that $2,000 over the full year. So what that means is if you go and fill a prescription in January and you hit that $2,000, you might not have to pay it. You can pay slowly each month to hit that $2,000. So I've discussed original Medicare, but if someone wants a different option, their option is a Medicare Advantage plan, often referred to as Medicare Part C. It lumps Part A and Part B together. The majority of them have prescription drug coverage, and they have an out-of-pocket maximum. Now, there's some drawbacks of having a Medicare Advantage plan that sometimes people aren't prepared for. So where I talked about original Medicare is fee for service, and you can go anywhere in the country as long as that provider accepts Medicare. That's not the case for Medicare Advantage plans. They operate much more like a private insurance. You buy them through a private insurance company, and they have networks of providers. So people need to understand that and look into the networks before purchasing a Medicare Advantage plan, or else they may have a plan that doesn't cover their providers and therefore can be very costly. They also, the out-of-pocket maximum does not include prescription drug coverage. It's still going to follow those terms of Part D that we just discussed. So what this all boils down to quickly is that there are essentially two options for people considering Medicare. They can pick lane one if they're driving, and they're going to pick up all the separate parts, Part A, Part B. They can decide if they want a drug plan. The answer should be yes. And then if they want to deal with some of those out-of-pocket costs from Part A and Part B, they pick up a private Medigap plan. Or they can separately choose lane two, which is a Medicare Advantage plan, which lumps Part A and Part B. It most likely includes a Part D plan. If it does not, you do have to purchase a private plan. And it has an out-of-pocket maximum, so you can't buy a Medigap plan. Where do people go if they are considering their options for Medicare, since we are fast approaching Medicare open enrollment? Medicare.gov has a plan finder that is actually pretty useful and helpful in terms of government websites. You can put in your zip code and you can search for prescription drug plans sold in your area. You can even put in your prescription drugs in your pharmacies so that you can narrow down the plans that'll be helpful for you, and you can compare the costs of your drugs for those plans. You can also look at Medicare Advantage plans. Similarly, you can put in your providers and your prescription drugs. You can look for Medigap policies. It's not really going to tell you much about the specific policy, but it will give you an idea of what policies are sold in your area. You'll have to call the company itself to figure out how much the pricing will be. So when you're comparing plan options, we at Triage Cancer are a big fan of worksheets. So we have a whole worksheet that helps you do some math to figure out what works best for you and tracking your options. This will not be the only worksheet you see. So we also have a lot of Medicare resources if you're looking for more in-depth information on each one of the parts, as well as understanding the enrollment periods. So another example of federal health insurance is Medicaid. And while it's a federal program, it's administered at the state level. And I want to pause here because what that practically means for everyone is what happens in your state may not happen in another state. And it's really frustrating for people, especially when we do in-depth discussions about Medicaid, because they're like, this is not at all what happens in my state. And I understand. States have a lot of leeway in implementing their Medicaid programs. So it can cause a lot of discrepancies based on who qualifies, as well as what programs are available and how you qualify. So prior to the Affordable Care Act, individuals could only get Medicaid access in all states if they had a low income, a low resource level, and we're talking very low, less than $2,000 in a savings account, a life insurance policy that can be cashed in, things like that. And they had to fit through one of these 4 doors here. Most people who have a cancer diagnosis fit through the age blind disabled door. Bad name, I know, but it's the name they have. And practically speaking, for individuals diagnosed with cancer, they fall in through the age blind disabled door by taking yet another step. That's going to the Social Security Administration, that's getting approved for disability insurance, and then they can file for Medicaid. After the Affordable Care Act intended to expand Medicaid, and it created a 5th door where individuals could qualify for Medicaid just based on their household income and size. Unfortunately, the Supreme Court did not quite agree in mandating that for states. So it has been left up to the states to decide if they're expanding Medicaid. So this is part of the discrepancies that people see. You see that 40 states have expanded Medicaid. So if you live in one of those states, you can qualify just based on your household income and size, as long as it's below 138% of the federal poverty level. In the states that haven't expanded, you're going to have that low income, low resources, and fit through another door. So if someone doesn't have access to employer-sponsored health insurance or feels they can't afford COBRA, and they don't qualify for government insurance, then what's their option? Well, the Affordable Care Act also created an additional way to purchase health insurance, and that's through the state health insurance marketplaces, sometimes called exchanges. And this is the tiny little blue part of our pyramid here. What health insurance marketplaces allow people to do is go online and see plans sold by private insurance companies. Again, it's not government sponsored in their area, and they can compare the plans. There are some benefits of going directly through the marketplace. I emphasize this because we get a lot of pushback because it's been highly politicized. Plans sold on the marketplace are regulated by the Affordable Care Act, which means several really cool things, particularly for individuals diagnosed with cancer. You cannot be denied coverage or charged more because of your previous or current health condition. That's huge. It wasn't the case before. Also, if you're a woman, you can't be charged more because you're a woman. You used to be able to be. There are also some other important things. So there is a cap on an out-of-pocket maximum. If you're looking at plans in 2024, that cap is going to be $9,450. I understand that's still a lot, but it used to be way higher for an individual. There's also going to be financial assistance available to people, depending upon their household income and size. So one of the ways that people may qualify for financial assistance is called a premium tax credit. Practically speaking, if you qualify, what it does is it tells you an amount that you're going to have attached to your premium. So if you see a premium in the marketplace for $600 and you qualify for $200 in tax credits, you're paying $400 a month. There are also, based on income and household size, the potential for cost sharing subsidies. So this essentially allows people to get additional assistance for things like co-payments and co-insurance. Now, there are several ways to utilize the marketplace, and healthcare.gov is where I suggest everyone start. Even if you know your state isn't run through healthcare.gov. The reason I say that is states can run their own marketplace online, but a lot of them have duplicate websites that are a little bit different, that are scams, or some of them themselves, you're like, is this real? So for example, Pennsylvania's is Penny. So if you want to be confident that you're on the right site, you start at healthcare.gov. You'll be able to select your state. If your state's run through the federal marketplace, you'll stay on that page. If it's run through your state marketplace, it will boot you over to the appropriate website. For those who are not fans of doing things online and sharing this much information about themselves online, there is a toll-free hotline and you can do a paper application. Now, there are also people who can help you compare your plan options and make sure you're appropriately putting all the information in. And those people are called assisters. They are very different than brokers or agents. So marketplace assisters are independently funded. They are not going to benefit from a specific type of plan that you choose. They are going to be neutral. They are going to be able to help you walk through the plans in your area and help you pick a plan that works best for you. An agent or a broker is not a neutral participant, typically. They are usually contracted to sell specific types of plans, and they're not necessarily interested in being neutral or getting you a plan that works for you. I don't say this to scare people away from brokers. There are some good brokers out there, but there have been a lot of studies that show that brokers are not typically acting in the best interest of people trying to purchase health insurance. So if someone wants to find a marketplace assister, they can do so on healthcare.gov. They put in their zip code. It will automatically search for everyone in your area. If you just want an assister, you have to manually change it to that. So we get calls from people often who are very frustrated that they can't just pick a plan or change options whenever they want. So it's important to know when you can enroll. So employer plans vary. It's often in the fall. That's not the case for all employers. Check with your employer. Medicaid is rolling. So whenever you qualify, you can apply and try to get coverage. Medicare has open enrollment on October 15th, moving to December 7th, and the marketplace begins on November 1st. For Medicare in the marketplace, even if you pick a plan on the first day of open enrollment, they're not going to start then. They are calendar year plans. So they're going to start on January 1st. So you can take your time and make sure you're picking a plan that works best for you. So what all of this boils down to, and why we've spent almost a half hour just on options, is that there are more options available to people than there have been in the past. So people have to pick a lane though. So the first lane, if you've lost your employer-sponsored coverage, is to elect COBRA. States do have COBRA laws that may apply to smaller employers. So it's always helpful to check your state law as well. We track those on our website. Or you can choose to get a marketplace plan, because when you lose your employer-sponsored coverage, you will be eligible for a special enrollment period in the marketplace. Sometimes people have other group plans, maybe through a spouse, if you're 26 or under, through a parent, or in a school or association plans. Not all have special enrollments for when someone loses health insurance, so it's important to double check that your plan that you're looking at does. And then some people may also have access to Medicaid or Medicare. Now, what's really important when you're losing employer-sponsored health insurance is when you pick a lane, you're in that lane for the rest of the year unless you qualify for another special enrollment. So you can't pick Cobra and then decide 3 months later, Cobra is too expensive, I'm not going to pay. That will allow me to lose my Cobra coverage and get me a special enrollment in the marketplace. It does not work that way. You are stuck until open enrollment in getting your marketplace plan. There's one exception to this, bear with me, it's a little bit in the weeds, but if you go onto the marketplace and you find a plan that you love, that you think is going to meet your needs and your family's needs, but you go towards the end of the month, say you go towards the end of October, in most states, it's not going to start November 1st. It's going to start December 1st. So in that instance, you can purchase a market plan first, and then go back to your Cobra administrator and say, I want to select Cobra for that gap in coverage that I have. And then you can end Cobra when your marketplace plan starts. It does not work in the reverse. If you select Cobra, you've lost your special enrollment into the marketplace. So first marketplace, then go back to Cobra for the gap. So I know this was very high level and very quick. We have a lot of resources specific to losing employer-sponsored health insurance so that people are getting a plan that works best for them. So great, we know the health insurance terms, we know what our options are, where do we go, and how do we actually compare plans so that we know we're picking the plan that's best for us. So you can start with healthcare.gov if you're looking for marketplace plans. You select your state. You'll put in your information about your household size and income. Again, this is to evaluate if you qualify for financial assistance. And then you put in your zip code. What I see in my area of New York, someone in New York City is not going to see. They are that different based on your location. And then you'll typically get a screen similar to this. New York doesn't use the federal marketplace, but I have something similar to this. And you're going to see the plans that are available to you. And then you can start sorting by things that you think are important. So if you have a cap on what you're comfortable with paying for a monthly premium, you can put that range in. Marketplace plans are standardized in terms of meta levels. So when we talked about that co-insurance, this is how you can quickly tell what your co-insurance is going to be. At a platinum level, all plans are 90% the health insurance, 10% you. They go down 10% all the way to bronze, where the health insurance covers 60% of your costs, you're responsible for 40%. You can also search by health insurance company. I gotta say, this did not work for me too well in upstate New York, but it works in other areas. You can also select if you want an HMO, which is usually a narrow network of providers, versus a PPO, which may have some out-of-network coverage. Those are typically going to be more expensive. So when you search for them and you get this big list of 33 options, how do you compare your options? What I'm going to walk through is going to be examples using the marketplace, but just know that it works for marketplace, to employer-sponsored plans, a marketplace plan compared to an employer plan, or even Medicare Advantage plans. So we have 3 plans here from the marketplace. The first is a bronze plan with a monthly premium of $200 and an out-of-pocket maximum of $8,000. Oop, well, there goes my surprise. A silver plan with a monthly premium of $275 and an out-of-pocket maximum of $6,000 and a platinum of $400 to $2,000. So even though you saw the next slide, can you tell just by looking at the plans here which one is going to be the most affordable? Anyone want to take a guess? Just by looking. Huh? Partly. So let's assume you're going to meet that out-of-pocket maximum. Can you tell just by the monthly premium which one's the most cost effective? Okay, so different answers. So it's not a trick question. You actually can't tell just by looking at the monthly premium, and that's because there's some math involved. So if you're assuming you're going to meet your out-of-pocket maximum for the year, and you're going to all in-network providers, you want to take the monthly premium and multiply it by 12 because you're paying that every month, whether or not you use your health insurance. Then you add it to your out-of-pocket maximum. And if you're going to all in-network providers, you know what your total out-of-pocket cost for the year is going to be. So when you do the math, admittedly, I'm terrible at math, but when you do the math, you're going to find that while that sticker shock monthly premium of $400 seems like a lot, it saves you almost, actually a little bit over $3,000 a year if you're going to hit that out-of-pocket maximum. But money isn't all of it, right? So people need to make sure that they're checking that their doctors and prescription drugs are covered. So in the marketplace, you can put in your providers as well as your prescription drugs, and it will filter out those plans for you. A caution here, though, is that it's not always updated. And so you want to double check with your providers. I know that's wild, but you don't want any surprises at the beginning of the year. And we get a lot of frustrated calls from people who say, I asked my provider if they accept Obamacare, and they said no. And that's because Obamacare is not a plan. So you need to look at the full plan name on your website that's on your screen, and you need to read that to your provider. And here's why. Blue Cross Blue Shield has a ton of plans. So you need to make sure they know the exact plan you're looking at. In New York, the plans are super duper long. So they're like Blue Cross Blue Shield XPY 7000 AGFB. You want to read that whole thing to your provider so that you know that that's what they accept. So if people are overwhelmed and need more tools to pick a health insurance plan, we have an animated video that walks through this, as well as another worksheet that helps you compare your options. It does take into account different ways that out-of-pocket maximums can be calculated and helps you with the right formula for the type of plan that you're looking at in case you're not just looking at marketplace plans. And this is our friendly reminder that now that there are more options, you should be reviewing your health insurance options every year. It may be that your plan changes through your employer, or your needs change, or your family's needs change. So it's always helpful to double check every year. So we're not quite done. So we've picked a plan that works best for us. We know the terms, and yet we're still getting medical bills because unfortunately, having adequate health insurance isn't really enough to stop medical bills. And often people, whether they're beginning treatment or they're well past active treatment, are left feeling like this guy on a bench who is avoiding his medical bills to avoid unnecessary stress. While that's an interesting coping strategy, it's not one we at Triage Cancer really suggest. So we're here to provide some practical tips of how to manage your medical bills. So what makes this so difficult is you receive way too much paperwork every time you go and receive care. So from your health insurance company, you're going to get just 3 notices. We've received your claim, we're processing your claim, and then an explanation of benefits. The most important thing from your health insurance company is that explanation of benefits, because it's going to tell you what services you received, what your health insurance is covering, and what you're responsible for. Now, it would be great if those were simple. They, in fact, are not, and every health insurance company shows this information a bit different. And I'm going to warn you, it might not be this detailed. So this is our ideal explanation of benefits. And we're going to walk through it just so that you have an idea of how to start reviewing your medical bills. So your first ideal sign that it's an explanation of benefits, or EOB, is somewhere in bold letters. It should say, this is not a bill. It's going to tell you information about who the policyholder is, as well as who received the service. Here, they're both IDA, as well as a summary of your bills. So the total amount billed and the amount you may owe your provider. Now, this is where not all bills provide this much, or explanation of benefits provide this much information, but you should see a date of service. Some will give you like a description of the service provided, not all. So that's where those CPT codes are really helpful. They are Googleable. They're going to tell you what the service was. And then you're going to see a summary of essentially what was charged, what your health insurance is paying, and then what you're responsible for paying. Really great explanations of benefits will help you track your deductible and your out-of-pocket maximum so that you can make the most of your health insurance. Now, all of that's great if it came in that nice of an order. It doesn't usually, and you're still going to receive one other thing, and that's a bill from your provider. And we urge people not to pay the bill as soon as they receive it. I'm certainly not suggesting you make that decision in a vacuum. Tell your healthcare providers and let them know you're waiting for your explanation of benefits. And even once you receive that explanation of benefits, if the amount on your bill matches the explanation of benefits, still don't immediately pay for it. And the reason is we strongly suggest reviewing your medical bills. And that's because medical billing is a human process, and with it comes a lot of errors. So those CPT codes that we just talked about, if someone hits one number differently, you could end up being charged for a surgery instead of routine blood work. Or we've seen someone hit the same number twice just in the amount of services, right? So instead of being billed for one surgery, you're being billed for 11. Or you're in the provider's room, you're talking about different tests, they list out a few things they think you should get. Later on, that decision changes, and you only receive one of the 6 tests. If those weren't removed, you're being billed for all 6, and you only received 1. So it's really helpful to review your bills so that you're not stuck trying to get money back later. And then if you find any issues, you dispute them. And if things are not covered that you believe should be covered, you want to appeal. And we're going to talk about that momentarily. So again, we're big fans of organization here at Triage Cancer. So we have a medical bill tracker that you can download for free on our website. And you can fill in the details specific to your health insurance plan, your deductible and your out-of-pocket maximum. And then as you get your medical bills, you can add in as much information about them as you see here, and it will lower the amount of your deductible and your out-of-pocket maximum as you go. So there are some other parts of navigating health insurance that are rather frustrating to people. So the first is prior authorizations, and these are becoming more and more common as a way for health insurance companies to manage costs. And there are several challenges that we see people experiencing. The first is it has a ton of different names: prior authorization, pre-auth, all sorts of fun names. They all mean the same thing. The second most frustrating thing for patients is that there's no comprehensive list provided to you of what's required for a prior authorization. And it used to be rather expensive things, but now it's becoming more and more common to be needed in a lot of different areas. The third thing that we see that really trips people up is they think it's the provider's duty to get the prior authorization, and it is not. You're in contract with the health insurance company. So if your provider fails to get a prior authorization, you are still responsible. And unfortunately, that means typically that your health insurance company isn't going to pay for that service because you didn't get a prior authorization. And here's the really fun one that makes no sense. You jump through all the hoops to get a prior authorization, you get the prior authorization, you get the service, and then you get a denial from your health insurance company. So even though you got a prior authorization, it doesn't guarantee that your health insurance company covers the bill. So with that, we're going to talk about my favorite topic, which is health insurance appeals. And you may be wondering, Nicole, you keep adding things to my very filled plate. Why are you adding yet another thing? And it's because there's data that shows if your health insurance company denies a claim and people actually appeal it, between 40 and 60% of health insurance appeals are found in favor of the patient. So that means 50% of the time your health insurance company is getting it wrong, which is kind of scary, and they're saving a lot of money. So there are typically 2 levels of appeal, and we're going to talk about why I said typically in a second. The first is an internal appeal. This is you going back to your health insurance company and asking them to reconsider. Every health insurance company is going to have a different process. Follow the process of your company, even if some of the rules seem strange, like return receipt requested. Just do it. It's a more way for you to get through their process. If your health insurance company still denies after an internal appeal, you may have the opportunity for an external appeal. This takes the decision out of your health insurance company's hands into an independent medical review. Each state has its own process. We have a whole chart on our website tracking how each state runs their process. So let's talk more specifically about appeals. Your first step is understanding what type of health insurance you have. And I don't mean I have Aetna or I have Blue Cross Blue Shield. You need to understand, did you purchase that plan privately through the marketplace, so you have an individual plan, or do you have a group plan through an employer? If you have a plan through an employer, you need to take an extra step. You need to understand if it's funded or if it's self-funded, meaning the insurance company pays your costs directly. People blanket me at this point and say, well, I mean, I have a Blue Cross Blue Shield plan. I know that. That's what my insurance card says. That doesn't give you your answer, because larger companies, sometimes even smaller, will pay for something like Blue Cross Blue Shield to be the administrator, but they are still self-funded. So you can call the number on the back of your insurance card, or you can ask your employee benefits coordinator so that you know. The reason being is the appeals process is different depending upon that answer. Same with understanding if you have Medicare or Medicaid. So once you know your type of plan, you can get more specific on how you actually appeal. We have a whole cancer finances module online that helps you through the rules for each type of plan. But generally, once you understand what type of plan you have, you need to understand your reason for denial. There are several, as you can see here. The ones in green are more common that we've seen in terms of someone with a cancer diagnosis. And so what's really important once you understand this is gathering evidence of medical necessity. And we get a lot of calls about appeals, and people feel they need an attorney. What we suggest is actually you work very closely with your treatment provider, because they have they're a doctor, right? They have the medical knowledge to help you understand why for you it's medically necessary. And so again, that why for you is really important. So if we're talking about a prescription drug, or you need an exception from step therapy, for example, it may be because you have adverse reactions, or there's something in your medical history that makes them know this is not going to work. And they can help you by creating letters, showing evidence of your lab results, as well as maybe even pulling different types of publications that help support this opinion. So there are a few hurdles when we talk about health insurance appeals. One is getting access to your medical records, especially if you're across treatment providers. And we think it's really important that people know their rights to accessing their medical records. So we have a whole quick guide on this, because there are specific rules of the timeframes that you should be receiving your medical records, what you can charge for someone's medical records, and things like that. It's all in our quick guide. Another huge hurdle is understanding what peer review is. So peer review is part of an internal appeal for some insurance companies. And practically speaking, what happens is your doctor is supposed to sit down with a doctor of their choice and discuss why you need this care. What's really odd about this process, if you're an advocate, is that that doctor doesn't even have to have a specialty in what they're talking about. So you may get an OBGYN who's talking to your MD who's very specialized in oncology. So sometimes you can ask for at least to be an oncologist, right? So that's a step. But where we see more people confused is that they say, yeah, I've done the external appeal. I talked to a peer reviewer. That is not the same as an external appeal, and people lose out on their external appeal options because they didn't understand that. The other hurdle is knowledge. So going back to why am I adding something to your plate? Remember when I said 40 to 60% of health insurance appeals are found in favor of the patient? Unfortunately, only 0.1% of all health insurance claims that are denied are actually appealed. So not even a full percent. So that's some very scary data. And it's why we at Triage Cancer love speaking about health insurance appeals and have a lot of resources about it to try to make the process easier for you. So as a recap of everything we've discussed today, a big part of kind of navigating finances after a cancer diagnosis is making sure you understand the terms used in health insurance, picking a plan that works best for you, and then making the most out of it. So where possible, you should be trying to use in-network providers, making sure you get pre-authorizations. Please review your medical bills. And leverage out-of-pocket maximums. So I mentioned several times and kind of glossed over it for the sake of time, why an out-of-pocket maximum is important. And here's why. If you reach your out-of-pocket maximum, say sometime around September, and you are overwhelmed because you've been dealing with a cancer diagnosis and staying on top of that, and you have other types of care you need to get, perhaps now is the time to get it because your health insurance is going to cover it at 100% instead of getting it in January and then being hit with a new deductible and a new out-of-pocket maximum. So there's obviously other factors that go into people's decisions. It's just something to think about. And then please, please, please appeal when your insurance denies coverage. So I've pointed back to a lot of our resources, but another free resource we have is our legal and financial navigation program. I promise the quickest way to get us is not to call us. It is to complete an online intake form at triagecancer.org/get-help. We will ask you a lot of questions related to demographics as well as what's going on. The reason that the demographics matter is based on your state, based on your employer size. Those types of things can all change the options that are available to you. You will then get an automatic scheduling email to pick a time that works best for you to speak to us. We will ask you more questions, and our goal is to explain your options, talk about the practical next steps, and empower you to take those steps. So thank you all for having me, and I tried to leave some time for questions. So in terms of appeals, again, because this was a brief overview, when people have access to an internal and external appeal, if it's considered an emergency, they can do an urgent appeal. What's considered an emergency, you need to work with your provider, but practically speaking, for those of you that are also online, what it allows you to do is do the internal appeal at the same time as the external appeal, and there has to be a response within 48 hours. In terms of seeing someone out of network, that's pretty difficult, although frustrating. What people often need to demonstrate, which you mentioned, is that there's no one in network that can provide the treatment. But it is a common concern that we see. And unfortunately, as of right now, there's not much in terms of like more steps to take. In terms of your concerns with Social Security, disability insurance, and Medicare, there has been a push to eliminate that 24 months that you need to be getting payments before receiving Medicare. It has not gone far, but there has been kind of a push to try to get people access to Medicare sooner. Yeah, so we're an educational nonprofit, so we won't actually like file the appeal or write the appeal, but we try to give people the next steps to consider taking.
Thank you. The chat here has been really popular, and a lot of thanks for the presentation from a lot of the attendees. One question is about the availability of your slides, and I know that this is also being recorded.
So we do not share our slides because a lot of this information changes rapidly. A good example is the access to Medicaid, which seems to be changing frequently. But all of the information on our slides is available online through our various resources. So for example, we categorize our resources by topic, people can go to our topics page and find all of our information about health insurance. So plans that are governed by ERISA may be able to go that step, but oftentimes the external appeal is kind of the end, but it really does depend, which is where we point people to our legal and financial navigation program, because we'll get the additional information and do the research. Okay, so the question was around prescription drug coverage, and if you switch plans, there could be changes in terms of how your new plan kind of views those medications. So the answer is it really depends, right? So a key part of like understanding the terms and the formulary is making sure that when you're looking at your options for the next year, you see how that plan views things. Once you're in it, it's really following their appeals process, right? So in terms of, is it maintenance versus is it just a life-saving drug, you'd have to work with your treatment provider to show why it's medically necessary for you to get that prescription. And so then it's following the appeals process for that plan. And so sometimes you can, you know, your provider can use both of those things. Like you don't have to do a separate appeal for each thing. It's these medical conditions and these medical conditions, right? It's similar to when someone's applying for Social Security disability insurance. We get a lot of questions about like, well, what if I have multiple medical conditions? You want to be giving the Social Security Administration all the information because it may be a combination of everything together that makes it medically necessary or shows that you're disabled. Okay, so the question was having more than one health insurance plan and if that's going to work as like a backup. The answer, annoyingly, is it depends. So what you're talking about is a coordination of benefits issue. And so if your husband's plan is through an employer, it could depend on his employer size and your new employer size on who pays first. There are also specific rules if you have a marketplace plan and an employer sponsored plan of who's going to pay first, right? And so all of that is going to change how effective your backup plan is, but also your backup plan would need to have the providers in your network, right? As well as any prescription drugs that you're concerned with. So it's all of these things, but times two, right? You want to check for his plan as well as a plan that you're looking for in the future. It would be understanding more about their plan, right? So when you apply to any job, once you're like going through the process, you can typically ask, hey, do you have an employee benefits coordinator or an HR, or can I see copies of the health insurance plans that are available to you once you're employed here? Then you can start to do like the unfortunately heavy lifting that a lot of this is, right? Of like seeing, well, is it a great plan, but it has an $8,000 deductible before it kicks in, right? Like things like that. And then you can start to do the work of, do these match the providers we need? What does the formulary look like? And kind of move on from there. You can, it just might not be your backup. Depending upon how the coordination of benefits works, it could end up being your primary and your husband's a secondary. All right. Well, thank you guys for coming.
Thanks so much.